Welcome to Best Practice. I'm Dr. Dan Lieberman. I've got my shorty spine out today because we're in the spine. Today's caller is Rick. He's experiencing low back pain. Rick is actually an old former patient of mine, so I know him from back in the day. Really looking forward to hear what's going on. Let's hear it from the horse's mouth and take it from there. Well, I am absolutely delighted to see both of your smiling faces today, but we're not here on a happy occasion. So tell me what's going on with your back.
I've been having some lower back problems again after the DVR that we had a few years ago. And it's like a sciatic. It goes down the lower back into the right side this time instead of the left, but it goes all the way down to my foot.
And is it on the inside of the foot toward the big toe or the outside of the foot by the little toe?
The little toe.
By the little toe. And
Yeah.
have you noticed any weakness maybe in getting up on your toes in your ankles?
I haven't noticed any weakness yet.
Good. Have you noticed any numbness in your foot?
No numbness, no tingling, just pain.
Uh-huh. And that pain, it's like electricity. It starts in the back and zings down.
Yes.
What triggers it?
Standing, just walking. I used to have pain more or less just standing in long walks, but now right away, as soon as I stand up. Sitting and laying down is what I can do to get rid of it, and not even sitting all the time. Sometimes I have to really ease into the chair. It really, I mean, the pain is in my butt too. It hurts, when I sit down.
Mm-hmm.
But once I'm kind of comfortable, I'm sitting, then I'm fine.
Okay.
I think with activity too.
Activity, yes.
Yeah. And it's all on the right and none on the left.
Yes, which is funny because I still have pain on the left. That used to be the one that was the worst, is on the left, but now it's switched over to the right side. And just below the ribs in your back, I get a real sharp pain like somebody's sticking me with a poker.
Now, that pain higher up in the back, is it on the right or the left or both?
It's on the right.
Now, Rick, we got to be careful because pain that high up is often kidney pain. But in your case, you did have that high up fusion years ago. And it could be that we're getting some joint issues above that old fusion. It escapes me now. What caused that injury up high?
The injury first was in '93 when a grain elevator fell on me, crushed my back.
That's right. Oh, yeah.
But then I was, working on loading trucks and everything most of my life. And I worked for a trucking company, and I slipped on a ramp with 400 pounds of potatoes and hit my tailbone. And that's what started everything back up in '93.
Right. Just spun it back up like a bad record, huh?
Yeah, but before that, I never even took an aspirin.
Yeah.
I was fine.
Yeah. All right, let's take a look at your MRI, okay, and some of the imaging that we've got.
They said you're the new one?
Yeah.
Okay.
Hang on a second. We're just going to pull it all up.
Yep.
All right, this is your new imaging. And to start out with, remember, we've still got, so this is you from the front. So here's your ribs and the thoracic spine. Here's where that original accident where they did the fusion. And then down here are the bones that are also very, very arthritic, where we're nearly bone on bone at each level. And then, of course, here's your hips. And out here, the sacroiliac joint on each side. And both of those sacroiliac joints are pretty arthritic as well. Let's move from, they did have you bend, so let's take a look at those bending x-rays real quick. And there's a little bit of an offset between the 4 and the 5, but it's not bad, and it stays pretty stable when we look between views. Now here's the MRI. And on the MRI, we've got the old L4-5. And on this perpendicular view, we can see where the nerves, we can see that perpendicular angle. And on the right at the L4-5, there's pretty extreme narrowing of what's called the foramen. And the foramen is the hole that the nerve root goes through. On my buddy here, the mini spine, this is a guy facing you, and these are the spinal bones. And if we rotate them to the side, these are the nerve roots, and the holes those nerve roots come out of are called foramen.
It stopped moving.
Okay, well, let it catch up for a second.
Okay.
Are we there?
Not yet.
Well, that's called the foramen. Let me keep talking so you can get
Okay.
get the information, and hopefully this video is going to catch up. Boy,
Okay.
this internet, I'm telling you what. I'm going to stop sharing and then share again, see if we can
Okay.
get this right.
Alrighty.
Is that better?
We can see the pictures.
Oh, good. Okay. Well, so this is the hole that the nerve root comes out of on that right side where you're having the pain, and
Okay.
it's quite narrow. As we get down to the L5 to the S1 on the right, the hole looks pretty good. So it could be on that right side. Suspect number one, Your Honor, is
Okay.
this hole is too narrow. And that does make a lot of sense with the kind of pain that you're having. Yeah, see, it's right, all this stuff out over here. And
Okay.
now it's a little bit the wrong nerve. I would expect that nerve to be more the L4, which goes to the inner ankle, but everybody's different and you never know. That very well could be the issue.
The stabbing pain in the back on the right side, just below the ribs, I was telling you,
Yeah.
that one just started like maybe a week and a half ago.
Yeah, I mean, I think you need to go to your primary doctor and get your get your urine tested, make sure we're not dealing with a kidney infection. So,
Okay.
but it's probably not, Rick, but that's one of those things where what if it is and we miss it, then that's only going to get worse. And no fever,
Okay.
shakes, or chills, right?
No, other than that, I'm fine.
I mean, it's probably not what it is, but you have a primary care doctor?
I do.
Okay. Go into them, just say, hey, I've got this kidney pain. I just want to make sure, I think it's my back, but I want to make sure it's not my kidney. Can you check me out? And they'll get some blood work and examine you. That'll take 15 minutes. And let's just rule that out for safety's sake.
Okay.
All right. Well, this narrowing of this right foramen, that is typically a nerve root problem, but we don't know for sure. And so we generally have to go to a test in order to find out if that's really what it is. And that test is a diagnostic block. You've been down this road before.
Many times.
I know. I'm sorry. You're a frequent. You have a frequent flyer card? Do you get a little punch every time you get a spinal injection? You're gonna get a free ice cream out of this. Is she gonna get? You would deserve one. You deserve a whole gallon of free. It's and when I look at your X-ray from a mile away, you see guy with back problems. It's just it makes sense, and good for you for dealing with it in a consistent and rational way. So I admire what you're doing. Now, what will happen next is you need a pain management doctor to examine you, see which nerves are not working. If it is possibly that L4-5 level, they can do a transforaminal epidural injection as a test. Normally they do epidurals to help you. This one would not a problem if it helps, but we're really doing it as a test to see if we can temporarily relieve that pain. If you can, then given the severity of the narrowing on the MRI, you're looking at surgery to open that up again and try to get more space in there for that nerve root. Short of surgery, there are medications, the gabapentins and Lyricas of the world, which can lower the transmission of the nerve, but they're dirty, dirty drugs. They cause so many side effects. Have you ever been on those?
No, but they gave me, what was that pills they gave me for 5 days?
Oh, the Medrol dose pack?
Prednisone.
Prednisone, they put me on and the pain went away until the pill stopped.
Yeah.
And when
So
it
it's
was there.
So that's a really good clue. So you were given a stress dose of steroid, a peak.
By the pain management doctor.
Yeah,
Right.
yeah. And those steroids are anti-inflammatories. And so when your anti-inflammatory steroid was the peak, you got relief, and then as it wore off, it came back. So we know this is a inflammatory condition, and it's a little misleading, the word inflammatory, because when the stenosis, when the hole gets too narrow, that leads to inflammation or irritation is more how I think of it, where the nerve root leaves the spine. So this guy, the nerve root, we're talking about this between the 4 and the 5, and it's this hole where this guy comes out. It's, if I keep turning him around, see how
Mhm.
the wall of the foramen is the joint of the spine?
Yep.
Well, what that's happening is the wall is moving in as that joint enlarges and expands with arthritis. And when your walls move in, your room gets smaller. So it's becoming more narrow. As it becomes more narrow, it becomes more irritated. And that's why the anti-inflammatory steroid pulse worked. We could just keep you on steroids forever and try to have you try out for the Diamondbacks and hit some 500-yard home runs. But no, the reason that sports heroes and everyone else can't take steroids, besides that it's unfair, is that it's horrific for your body. It's the dirtiest, one of the dirtiest of all drugs, and it's just horrendous for your body. It causes you to gain weight and suppresses your immunity and heart problems and hoarseness and impotence and every other problem you don't need. So it's just not an option. So we may be looking at a surgical approach as the next step. Having said all that, really what you need first is the right diagnosis. You have a complicated back, it's tricky, and we need to make sure we get it worked up in the correct way. Who's your pain management doctor?
His name is, the heck is the guy's name now? Adam Kramer.
Okay, a good doctor?
Yeah, he's pretty good.
Okay, is he specializes in pain management? That's all he does?
Yeah, he wants to do an epidural.
Okay, well, that's actually what I want him to do too, but I want him to do a specific kind. Is he board certified in anesthesia or physiatry? Do you know?
I don't think he is there.
I'll find out about that and make sure you're seeing the right person. We really recommend pain doctors who have 3 credentials. They're board certified in anesthesia or pain management. They also specialize and are fellowship trained in pain management. That's their specialty. And last but not least, they don't rely on a bunch of narcotics. Are you taking any narcotic pain pills?
I'm taking Nucenta at this time, 75 milligrams.
Okay. How long you been on that?
I had it up, it was 50 milligrams. I've been on that since I've been seeing him a couple of years.
Okay.
And the pain was getting worse, so I asked him if they could move it up. And it took a while with the opioid epidemic and everything, but he finally gave me some more of it. Seriously, the last probably a couple of weeks, she's been noticing me having a few cocktails that night. Helps the pain, you know.
Yeah, but not healthy, right?
No, I mean, I don't drink that much. I mean, we put a 12-pack in the refrigerator. It usually lasts almost a year, you know. But
a beer a month, you know.
Yeah.
They say an alcoholic is someone who drinks more than their doctor. I only drink half a beer a month, buddy. So you're.
I guess that's it for me.
I don't think a beer a month is going to hurt anybody. That's for sure. Having said that, that's not the way to go. You know that. The way to go is to. Yeah, the way to go is to find out what's wrong and fix it. That's what we're going to do. We'll.
This is why I wanted to see you.
I'm glad you did. I'm glad you did. We'll work with. Let me make sure Dr. Kramer's 3-star guy probably is. Sounds really good. And then we'll get you that block. And then if you're willing, I'd love to have you back on the show. We can get you on from home. You don't have to come into the clinic if you would prefer.
Okay, that's fine.
All right, we'll set that up, Rick. It's good. It's really good to see your face and hear from both of you today.
All right,
Yeah,
thank
same
you.
here.
All right, talk to you soon.
All right,
Okay.
take care.
Bye now.
Bye.
Very interesting. I'm sorry Rick is suffering. This is low back pain with radiation to one side, feels like electricity, but no numbness and no weakness. A doctor has to sort out whether that is nerve root pain or whether that could be facet joint pain or whether it could be some combination of both. And when we looked at Rick's x-rays and his MRI, he's certainly entitled to have either facet joint arthritic type pain or nerve root pain. And that's very common in the spine. There's often more than one thing going on. And then it becomes a question of apportionment. Well, is it 80% the nerve root and 20% the joints, or vice versa? Because our treatments aren't one size fits all. Our treatments are aimed at the exact cause of the pain. So that is an essential apportionment that needs to be figured out before we can go on. How do you know if what causes what and how much? You can find out what's causing pain by blocking it. If you can block it, you can tackle it. That's exactly what needs to happen next to Rick. I think his pain, because of the electrical nature of it, is probably mostly coming from the nerve root. So if we can get that, once we get that pain management doctor to block that nerve root, if that relieves 80% of Rick's pain, then we know that 80% of the pain is coming from that nerve root. If that relieves 0% of Rick's pain, then we can assume that 100% of that pain is coming from something else. And then we'll do a different kind of block of different structures to figure out what's causing it. Once we can block it, we can tackle it. That's the next step for Rick, and I'll look forward to showing you his progress here on Best Practice Live. Have a great day. If you have a question you would like answered on Best Practice Live, there are 3 ways to ask. Leave a comment on any of our social channels, click the link to our website and complete the submission form, or call or text us at 608-602-4022. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health. Lastly, be sure to check out new episodes every weekday at 10 a.m. Pacific, 1 p.m. Eastern, where we answer all your questions.